Sudden cardiac death or sudden cardiac arrest is an arrest or death that occurs within 1 hour of athletic event. It is rare in the young student athlete, but it is tragic. I got involved in this over 10 years ago when we had 3 student athletes within a 10-mile radius of this office who dropped dead during athletic events, which I feel, if there had been some sort of cardiac screening, may have been identified and preventable. Through the Morahan Center in the last 10 years, we have been providing free screenings to student athletes, including teams, particular schools, but we do an event each year that is free to the entire area.
To date, we've done over 25,000 combined concussion and cardiac screening, so we're really capturing a lot of athletes. We're making a very large footprint to keep them safe, be proactive, and find out, if there's underlying issues that could cause problems down the road.
I don't even like to start with testing. More important is the history. Symptomatology, chest pain, shortness of breath, syncope, especially during physical exercise, are really important measures of risk for children that are going to be on the athletic field. What we have done recently is adding an electrocardiogram.
Basically, as we explain it to parents, it's a little quick snapshot of your heart, and that looks at the electrical function of the heart, the rate, the rhythm, things that you can't get from a normal sports physical.
Not just the electrical system of the child, but also whether there's any potential injury to the muscle of the heart that would put them at risk of an abnormal heart rhythm during physical exercise, or enlargement, thickening of the muscle of the heart. So it's a sensitive tool, not specific, but is helpful in determining risk. Beyond that, if we find a potential problem, we can go to other testing, such as an echocardiogram, which not just looks at structure of the heart, but looks at size, function, any dysfunction of the heart itself that would also put a child at risk on the athletic field. It's not a black and white answer, but I think any student athlete, especially as we get to middle school, should at least have this standardized questionnaire, a good clinical exam. And New Jersey has been proactive. Each sport, before the child can be cleared, there are forms that each pediatrician needs to fill out. And if there's questions on either the family history or the clinical exam or symptomatology from that child, then they end up having to see another specialist such as myself for further workup prior to clearance to playing that sport.